I generally like to do fun videos. This one isn't fun. Buckle in. In a hospital in Nashville, Tennessee, a boy lay dying. It was about 15 years since the end of World War I, and the medical community was unsettled. The last decade and a half saw the outbreak of a global influenza pandemic, and on the heels of that, a mysterious and frequently fatal brain illness that left many of its victims dead and the survivors crippled. It was called encephalitis lethargica. The cause was, at the time, a mystery, and remains a mystery to this day. This is not a video about encephalitis lethargica, but context is important, because in trying to solve this mystery, the American physician James Dawson accidentally solved another. So, in a hospital in Nashville, Tennessee, a boy lay dying. More properly, a young man by the standards of the time. 16-year-old WW, as he is known by the records, had led an unremarkable life until one day, 18 months prior, he was found unconscious on the street. He recovered without issue, but then, 6 months later, it happened again. The doctors of the time diagnosed sunstroke and sent him home. But over the next 12 months, family members reported personality changes, bizarre behavior, and forgetfulness, all getting worse with time. He started moving slower and with more difficulty, until finally, he began to experience involuntary and uncontrollable muscle jerks. He was admitted to the hospital. Doctors at the time noticed his difficulty moving, speaking, unusual posture, as well as periodic involuntary convulsive jerking of his arms and legs. His course in the hospital was one of progressive deterioration. In less than a month, WW was dead. When looking at sections of his brain under a microscope, Dr. James Dawson observed that WW's case did not look like a typical case of encephalitis lethargica. There was extensive cellular damage, and the presence of distinctive inclusion bodies, which made him suspect the cause to be viral infection. However, despite trying, he was unable to isolate an infectious virus from any of the samples. Dawson's findings would be reproduced by others. The combined medical findings of a clinical course of slow progressive mental deterioration and characteristic microscopic brain damage on autopsy would enter the medical terminology of the time as Dawson's disease. Now, as I mentioned, Dawson suspected, but couldn't prove, that a viral infection was responsible for WW's illness. The scientific field of virology was incredibly young, and doctors weren't really sure what a virus even was, other than it was infectious and incredibly small. You couldn't see viruses by conventional microscope, asterisk, and the first viral particle wouldn't be visualized until 5 years later in 1939, with the advent of new electron microscopy technology. The only way to reliably prove the presence of a virus was to take suspected infectious material and transfer it to cell culture or a laboratory animal, and have that infection propagate. Dawson couldn't successfully do this, and neither could anyone else. The cause of Dawson's disease would remain a mystery for another 30 years. In 1965, French physician M. Boutiel used an electron microscope to examine brain tissue from victims of Dawson's disease, and found proteins that, in his estimation, looked to resemble structural components of viruses from the paramyxovirus family. Around this time, breakthroughs in immunology were allowing scientists to start detecting viruses and proteins using antibodies. The key breakthrough for Dawson's disease came in 1967 when British physician John Connolly used antibodies to definitively detect the proteins of a certain virus in a brain of a victim. That virus was measles. All patients with Dawson's disease had measles virus in their brain. The clinical symptoms: slow cognitive decline, involuntary muscle jerks, coma, and death were caused by the progressive destruction of brain cells by the measles virus and associated inflammatory response. The issue was that most who developed Dawson's did so in their early to late teens, but virtually all of them had contracted measles during early childhood. From that point onward, from the age of 2, 4, 7, or what have you, they lived normal lives, went to school, played with friends, dreamed of the future, unaware, completely unaware that they were under a biological death warrant, signed and sealed by a silent killer. This story doesn't have a happy ending. These children will never live to see adulthood. Let's talk a little about Dawson's disease. First, the name. While the name Dawson's disease or Dawson's encephalitis are still in use, in medical literature the disease is usually referred to as subacute sclerosing panencephalitis, or SSPE. This is a descriptive name using fancy words, a long-standing tradition of the medical community, but I'll break it down. Subacute means not fast, but also not slow, and refers to the fact that the disease usually takes between 1 and 3 years to progress from onset to death. Sclerosing means that the disease leads to stiffness of the affected tissue, usually as a consequence of tissue damage. Panencephalitis means that inflammation is present in the entire brain. For ease of elocution, I'm going to keep calling it Dawson's disease, or simply Dawson's. Now, the cause. Dawson's is a rare consequence of infection with the measles virus. A typical measles infection causes a flu-like illness with a cough, eye redness, and a rash. The symptoms last about 2 weeks, and the virus itself hangs around at a very low level for a few months, but after that it is eventually cleared from the body entirely. Now, regular measles infection is dangerous, especially if compounded by poor access to healthcare, poor general health, or malnutrition. But the typical course is that you get it, recover, and are immune for life. But in roughly 1 in 10,000 measles patients, the virus gets into the brain, infects brain cells, and continues to survive there even as the rest of the body completely eliminates the virus. We don't know how or why this happens. We suspect that it has to do with an underlying problem with certain components of the immune system, based off the fact that Dawson's is more likely to occur after infection in very young children with relatively undeveloped immune systems, firstly. And secondly, because severely immunocompromised people who contract measles can also progress to fatal brain infection, though in their case that happens much more rapidly. But in one way or another, due to immune system failure or for some other reason, measles gets into the brain and stays there. From this point, an infected individual lives a normal life for, on average, about 10 years. Outwardly, everything is perfectly normal. What's happening on the inside isn't really clear, but we do know some things. Measles is pretty unusual for a virus in that it has 2 ways of spreading. The first way is the normal way viruses spread. Start with a viral particle, infect a cell, make more viral particles to spread out and infect more cells. The second way is more unique. Measles can make 2 adjacent cells fuse together and jump directly from cell to cell. No viral particle required. This second way is how it spreads in the brain, hopping from neuron to neuron and possibly occasionally to surrounding helper cells without ever actually producing viral particles. Over years, the measles virus in the brain evolves to make its cell-to-cell infection ability better, but completely loses its ability to generate functional viral particles. This is why Dawson and others were never actually able to take infected tissue and culture virus from it. One other thing about the measles virus is that it doesn't seem to have a latency mechanism. Some viruses, like HIV, can get into a cell and stay dormant for years. Measles doesn't do that, as far as we can tell. Once it's in the brain, it's probably spreading. Very slowly and very, very inefficiently. But eventually, there is enough measles virus protein and enough cellular damage in the brain that the immune system starts to notice. At this point, the damage to the brain from the inflammatory response, combined with the damage caused by the virus, starts to manifest as the first clinical symptoms. It starts slowly with memory loss, personality changes, and intellectual dysfunction. With most cases manifesting when the affected are in their teenage years, declining school performance is usually the first telltale sign, along with increased conflicts with family members and friends, or social or emotional withdrawal. At this early stage, this set of symptoms looks a lot like clinical depression, or similar psychiatric illness leading to frequent misdiagnosis. While psychiatric medication may alleviate or more properly mask some of the symptoms, they will not stop or slow the progression of the disease. Within 6 months to a year of onset, typically, the intellectual dysfunction progresses to full-blown dementia, and victims begin to experience the telltale involuntary muscle spasms properly indicative of true neurologic damage. This may be accompanied by difficulty speaking, inability to maintain a proper posture, and double vision. Most diagnoses of Dawson's disease are made at this stage of the illness. What follows is, again, typically, a year or more of progressive decline. Rare muscle spasms become more frequent and transform into writhing movements and whole body rigidity. Victims lose the ability to move, take care of themselves, or communicate. Rigidity then gives way to paralysis, coma, and, soon after, death, as the body's nervous system is no longer able to maintain the basic functions the body needs to stay alive. Dawson's is almost invariably fatal, even with treatment. Less than 5% of patients survive 4 years after diagnosis. Patients who survive more than 10 years are so vanishingly rare that it's hard to apply any meaningful statistics. But scattered case reports exist of people experiencing partial recovery and resuming normal or close to normal lives. For others, the disease might stabilize in an advanced stage, and these patients require lifelong nursing care. Finally, some people see remission and possibly mild improvement for several years, followed by a resumption of progressive deterioration. The current standard of treatment is an oral drug with some antiviral properties, as well as regular injections of synthetic interferon alpha into the fluid surrounding the spinal cord. Interferon is a protein normally made by the body during the immune response, and to simplify things somewhat, it tells your body's cells to fight virus harder, among other things. Together, these two drugs have an estimated effectiveness of about 30% in Dawson's patients, but effectiveness here is a very loaded word. In this case, it may mean temporary remission or slowed progression. It's not clear whether treatment improves the survival rate at all, but if it does, it's not by more than 1 or 2%. In aggregate, 1 in 10,000 people who catch measles go on to develop Dawson's, but for children younger than 2, the rate can be as high as 1 in 1,000. Currently, there is no procedure for screening or early detection. With measles making a resurgence all around the world, we can expect to see a rash of Dawson's cases popping up in about 8 to 10 years. These are healthy kids with bright futures ahead of them, suddenly deteriorating mentally and physically, and dying, because of a chance encounter with a virus 10 years previously. Something that was completely preventable.